The United States spends $5 trillion on healthcare every single year. That's trillion with a T. Now, to put that into perspective, that's more than the entire economy of the country of India. That's a country of 1.5 billion people. Now, the question that might come to your mind is, where does all that money go? At the time where patients really struggle to access some of the most essential health services in the States. The money flows to all these giant systems, the payer networks, the insurers, the provider networks, the hospital chains, the investors, the shareholders. And while the US pays way more than its peer countries on healthcare, patients still receive way less and are struggling. So if you're someone who buys insurance or paying taxes, you're still paying into the system, but getting locked out of care. And there's a very, very obvious imbalance of power here, where all these layers of the system have so much more power, while you, the patients, the caregivers, the families, everyone who is going to be sick in this country, which is basically everyone, have to go through it all with the least amount possible of power. People are confused, they're overwhelmed, they don't know what to do, they don't know where to go, when, for what, how much, is it covered by insurance or not. And as health providers, maybe sitting one small layer above on the power chain, we still sit at the end of it and have very limited power over the outcomes. I'm a medical doctor, and I was very frustrated with the constraints that were imposed on me and my ability to help patients. That's why I decided to quit. I left my residency halfway through because my patients needed more care, more support, more clarity than I could ever provide. So I moved to the Silicon Valley with the goal of building tools for those patients to help them navigate the system and improve their care journey. And I started this account because I wanted to listen to your stories. I want to hear about the journeys that you've had going through the American healthcare system. The diagnoses, the treatments, the misunderstandings, the challenges, the problems, everything you've gone through. And one thing I can promise is that not only am I under the Hippocratic Oath to do no harm, I will always strive to do good and help patients as much as I can. And if this resonates with you, thank you so much for following the journey. Please pre-order my app. It's free, it's one click away, and it